Welcome to the Veterinary Blueprint Podcast, brought to you by Butler Vet Insurance, hosted by Bill Butler. The Veterinary Blueprint Podcast is for veterinarians and practice managers who are looking to learn about working on their practice instead of in their practice. Each episode, we will bring you successful, proven blueprints from others both inside and outside the veterinary industry. Welcome to today's episode.
Welcome to the Veterinary Blueprints Podcast. I'm your host, Bill Butler, bringing you business and entrepreneurship insights for the veterinary community. Today, we're joined by a special guest, Dr. Gianluca Bini, a board-certified veterinary anesthesiologist and founder of Safe Pet Anesthesia. He recognized the limited access to specialized anesthesia care, and he launched Safe Pet Anesthesia to improve patient health and educate veterinary teams. In addition to leading this initiative, which I'm sure takes a lot of his time, he is an assistant professor teaching on anesthesiology and pain management at Oklahoma State University. So let's dive into this journey and impact of expert anesthesia care for veterinary medicine. Welcome, Dr. Bini.
Thank you, Bill. Thank you for having me. And it's an honor being on your podcast.
Absolutely. So we met at VMX. I was just walking around and you had a beautiful golden retriever in your booth on the last day, I believe. And I just was like, your dog stopped me in my tracks and I wanted to say hello. And in fact, one of your aisle mates said, you should go talk to Dr. Bini. He's got a very interesting product. And a past podcast guest from Vetland. And so we struck up a conversation and it kind of went from there. So why don't you tell, I got a little bit of your background, but why don't you share for our guests, your start to veterinary medicine and how things got going for you?
Yeah. So I started, my career starts in Italy. I'm originally from Italy. I graduated from the University of Perugia. That's where I got my DVM. I always knew that I wanted to be an anesthesiologist. It's really hard to get into that in Europe. Like there is very few places where you can do a residency in anesthesia. And so as soon as I graduated, I moved to England. I did 2 internships, one in anesthesia and the other one it's a rotating internship. And then I was always fascinated by the States and the training that you guys have over here. It's, really, really good.
Mm-hmm.
And so I wanted to come over here for my residency. I applied and I got into a residency at North Carolina State University. And then after completing that, I moved to Ohio State. I stayed there for 2.5 years as an assistant professor of anesthesia and analgesia there. And then when I left there and moving here to Oklahoma, I really realized how little access the average veterinarian has to an anesthesiologist,
Mm-hmm.
right? There is only about a little bit more than 200 of us in the country. Which, if you think about it,
anesthesiologist. So that,
yes,
there's people trained in anesthesia, veterinarians receive training in anesthesiology, but board certified anesthesiologists are a rarity.
yeah, it's a really rare species. And so, most of us are in academia or in highly specialized referral centers.
Mm-hmm.
Nobody is, dealing with GPs. Nobody's dealing with mid to small size referrals. And that's where most of the pets gets anesthetized, which makes it really, really sad, and it limits their access to one of us terribly. And so I was like, how do we make this accessible and affordable for these pets and these pet owners? And that's where the idea came from for Safe Pet Anesthesia. We created a custom-built platform that allow us to follow cases and receive video feeds from different devices. Most people use a smartphone, and they literally can just book us for a case, upload the medical record, scan the protocol that they want to use. We give them feedback on that, and then whenever it's time to perform the anesthetic event, they just pull us on their phone, and we follow the whole case from start to finish on video call, and we make this super affordable for them. And this was the only way of doing it, was to
Yeah.
do it online. If somebody had to go there physically between travel and all that stuff, it would make it insanely expensive for the average veterinarian, which is not
So
good.
that's a big jump, being an academic, Ohio State University, and then going to Oklahoma, and then saying, I'm going to be an entrepreneur. And your wife was with you. She's kind of your sidekick, business partner, probably not your sidekick. You're probably her sidekick.
And
Uh, Based on how things, she's your social media person, dog wrangler. She looked like she was taking care of everything down there. And so I met the both of you. And so how do you sit down, as if there's another veterinarian out there who wants to, sees a need in animal health, you going from academia to saying, I want to open a, entrepreneur, I'm going to become an entrepreneur and launch this business. What did that look like? What was that conversation when you went home?
yeah, it was scary at first. It's kind of a jump into the void. You're used to um, being on a salary, and now now you actually have to invest money. And usually, FYI for whoever is listening, usually the first couple of years you actually lose money.
Yeah, it's,
You don't make money. um, that was an interesting way of using our savings, really.
yeah, you got to
um,
be passionate, and well, and there's a Beyonce quote, and the Beyonce quote goes like this: I don't often gamble, when I do, I always bet on me. And so, as an entrepreneur, you're betting on yourself that you're gonna come out ahead when you're making those educated guess gambles, I guess.
yeah, it's I really hope that the gamble pays off. um to be honest, like, it's been a journey, right? There's a lot of things that you really don't know when you start a business,
Yeah,
and even the small things, right? What hosting platform do you use for your website? Even little things like that. It's so easy to lose, a grand here and there. And like at the end of the year, when you actually like go and look at it, you're like, holy crap, how much money I wasted on stuff that I didn't know that, I should have done different or
or you get
whatnot.
a
But
booth
that's
at a national convention, or just buying T-shirts or giveaways to pass out. I mean, like, all those little things, like, okay, we're gonna go do a booth at a national show. We have to have some stuff to give away. What do we want to give away? Those are $4 each. Holy cow! It's gonna cost me, $5,000 just to have this stuff to give away.
100%.
And
Yeah.
so yeah, I think, when you go to start a business, right, there's the grand plan. It's like, this is the end vision, but it's all the small details from A to Z.
Yeah. The costs rack up
Yeah,
super easy, right? The other, and providing a service, I think, like this, where it's unheard of, right?
hmm,
Like nobody is doing this in the country. Um, Nobody's doing it for GPs. Nobody's doing it for small size referrals. There is a couple of people that do it for highly specialized places, but the difference in pricing is
yeah.
significant. Um, you know, it's hard because a lot of veterinarians don't even know that you exist. They don't even know that that's an option. And so like it's been hard, like, having those conversations. And a lot of people assume at the beginning that what you're doing is just give them a list of drugs that they can use.
Yeah.
And that's exactly what we do not do. We give you that, but we follow your whole case. And that's where the juice is.
Let's dive
The
into that. So, if I'm a veterinarian and, I want to practice safe anesthesia in my practice, what do you think, or what are your, if you're going to give me some of the safe practice, safe pet anesthesia essentials for my practice, what are some of those?
And yes, this is what I always tell my students, right? I give you the answer that I give to my students, and some of the clients I have that, the very first question they always ask is that, what's your protocol? What drugs do we use, right? And people get hooked up on that, but in reality, the true answer there is that it doesn't matter, right? Like the drugs that you use in 99% of pets, it doesn't really matter. What matters is that you know what the drugs do and how to fix it if something happens.
Sure.
Like and so monitoring, long story short, monitoring is key. The patients do not die because you use the wrong drug, assuming that you stay within, the normal dose range,
Sure.
right? Like, of course, if you give the full bottle of ketamine, for example, of course, that's a different story. But if you stay within the dose range, the patient doesn't die because you picked the wrong drugs, or if you had a better protocol, the patient would have survived. That's not the case. The reason why the patient dies is because the monitoring was lacking somehow, right? There is places out there, and nowadays this is rare, but there were some places, at least till a few years ago, where there wasn't any monitoring. They would monitor, pulse oximetry maybe, and that's about it. And that's not probably good practice
Sure.
anymore. We should, once you have proper monitoring and you have the know-how on what's happening, how can I fix this, that's how you make it safe.
Fixing something before it gets too bad to fix.
Too bad.
Yeah.
Yeah.
In my non-anesthesia layman terms. So, I've gone under anesthesia personally a couple times for a couple procedures. I'd broken a leg and needed a metal plate in my leg, and you go talk to the orthopedic. But when you're getting ready to go in, I go speak with an anesthesiologist before going under anesthesia. And so, I to relate this to animal health, my mom had a Gordon setter that really had bad reactions to anesthesia, and so and any sort of medication like that. And so, in the vet world, why isn't there more consultation with anesthesiology before a procedure?
Yeah, part of this is again the lack of personnel, right? Like there isn't enough of us to cover all that side.
Yeah,
It's actually a very easy conversation to have, and a lot of owners nowadays, they are aware. A lot of people go under anesthesia more and more often. Um, a lot of people had one of their family members go under, and they had that experience with the anesthesiologist, and they would really love to have that for their pet. A lot of the clients want to have some reassurance around anesthesia.
yeah,
When we started this business, we thought that veterinarians will call us for very complex cases. What we found out is that once we are out there in that practice, we end up doing a lot of spay and neuters, which are relatively easy cases. But the reason is that the owners want that. The owners is like, oh my God, you have something like this. I want it. I don't care about the extra, $100, $200. They're like, I want to have an anesthesiologist watch after my pet. And so it is an option nowadays. With a service like ours, we can speak with the client too. Like if you have a client that would desire to have a chat with us,
sure.
we totally do it beforehand and after. I had actually a conversation with one of the clients from one of the clinics we followed the other night, and the dog was doing okay, but she wanted some extra assurance. She wanted to speak with one of us, and we did so. It's doable nowadays. It is doable.
Yeah.
It wasn't an option until a few years ago.
So as a entrepreneur myself and sales guy, 20 plus years in the sales world, just thinking about what you just said, if I'm a veterinarian and it's, $150 to have a monitoring of anesthesiology, and as I'm putting your pet under, that conversation is I've included in the cost of the spay and neuter monitoring of anesthesiology by this this organization, however you position that as a practice owner, right? If you don't want that, I can
Yeah.
remove it, but just include it on
Oh,
all
no,
of it,
no.
right? And then
Yeah.
you're including that service. And as a pet owner, even if I don't have a conversation with you, I know my pet's being monitored by an anesthesiologist versus, I nothing against anyone in the profession, but I don't know, again, it's the specialty of how that's being monitored, and that's where the case goes wrong. And so, if I'm a pet owner and I'm like, well, I can get this monitored instead of not, well, yeah, I'll pay the extra $100 on the $500 deal.
Yeah, it's an interesting concept, right? So some clinics do include us in every estimate they make. Some other clinics give them the option.
Yeah,
Some clinics do not give them the option. They just like throw it
they
in
just
there.
put it down.
You know, yeah, and it's easy enough. And it also make it easier for the vet, right? Like what happens nowadays, the way that works in most general practices or small referrals is that the veterinarian is focusing on the surgery, but also it gets asked all the time if anything goes wrong with the pet, what to do by the nurse that's taking care of the anesthesia.
Yeah,
The nurse is looking at the monitor, is watching, and it's monitoring, but the veterinarian gets quote unquote pestered continuously about, hey doc, this is not, the blood pressure is low. What do we do?
I'm
Right.
focusing
And
on
so
this
that
technical aspect of the surgery right now, not trying to monitor the vitals.
exactly right. So, the service doesn't just it helps the technician to have that support,
Sure.
right? And have their sole attention on that, aspect. And then it also helps the veterinarian because they can finally focus on what they do best, which is the procedure.
Yeah.
And so it takes away the stress from them. It takes away the stress from the owner. The technician, it's less stressed as well. They love it. They feel empowered. They learn a lot, right? Like when we don't just tell them, hey, do this. We tell them, hey, do this because this is what we're
Sure.
seeing and this is how it works. So it's also a learning opportunity for them, and um, it's a growth opportunity for the nurses as well.
You just
Um,
you're helping level up the entire team by using this service, right? Not just getting the service itself, but just being around, providing a higher level of care.
Yeah, that's exactly what we do. We also offer some, a lot of those clinics, they want also extra training.
Hmm.
So not only we do cases for them, we offer both online and in person. We have some clinics where there is one specifically in New York where they want us to be there every 6 months for a week for training. They
Wow.
use us every day for cases, but they also want every 6 months for a week to be there in person.
Yeah.
And so actually I'm flying out, in a couple of weeks and I'm going out there. Um,
So
so
let's
that's an
yeah, so let's
opportunity.
talk about the process, right? So you do the education piece, but what does the actual, your integration on a case look like to actually remote in and help with a case and monitor a case? What does that look like?
It's actually super easy, right? Like the clinic gets set up first. There is no cost. We don't have a contract really. It's on a per case basis. There is zero annual minimum
Hmm.
or anything like that. Nothing of that. We have an initial meeting and we chat about how their anesthesia look like at the moment. We send them a survey where basically they fill out like what drugs they have,
Hmm.
what monitoring they have, and a few other questions related to the anesthetic process that they currently do. And then we basically have a 5-minute walkthrough on like how does your anesthesia induction area look like, how does your ROR look like, so that the first time that we have a case we don't need to worry about
How
you
things are
know
set up, right?
exactly,
Yeah.
exactly. And we know how to help you because we know what drugs you have, what drugs you don't have, what monitoring you have, and so we're ready to go from the beginning. And then when you have a case that you want to schedule us for, you just go on our website, you schedule us for a case, and then the morning off, we already read all your medical records. You upload that when you schedule it, and then the morning off, you just send us a picture of your protocol that you're using for that specific pet,
Sure.
we tell you, okay, yeah, this sounds good, or maybe we need to tweak something on this based on what you already have, and we know what you have. And then whenever it's time, you just pull us up, on your phone. You literally log into our website. The video starts automatically, and we're there with you the whole time from induction to recovery.
So things
That's
go
it.
well, everything's fine. Let's say you're in the middle of a case and you notice something that is, like you said, going wrong, and you need to catch it before something goes wrong. How does that process work in the middle of a case?
So it's super easy. They just we just tell them, you're like, hey, look, this is what we're seeing on the monitor. They usually, most people use their phone, and they just point it to their monitor. We When we do the setup, we send you a tripod and a stand for your phone. That it's magnetic. It also sticks to metal, so like you can put it on your anesthesia
Oh,
machine and
sure.
whatnot. And so they just point us to the monitor, and we watched it the whole time. If we see something, we'll tell you immediately. We're like, hey, the heart rate is dropping. We need to give some atropine, for example, and we give you the dose and all of that, of course. And if they see something, and for example, they have a question, or sometimes because they point us to the monitor, the surgeon has a better view of what's happening,
Overall,
surgery
right?
wise.
Yeah.
So like, if the surgeon sees, for example, some little bit of extra bleeding, for example, or something like that, they can just let us know, and they're like, hey doc, this dog is bleeding a little bit more, shall we do anything different? And that's when we give them the suggestion. So it's a two-way conversation the whole time. We're there with you. It's like having one of us right
Yeah.
there with you, basically.
So because like ultimately at the end of the day, and I don't know, because I was under anesthesia when I was having my procedures, and I'm not a medical professional. So whatever happens, kind of behind the scenes. But my guess is, as an anesthesiologist, and correct me if I'm wrong, I'm just spitballing here. You're sitting in there monitoring. If you were actually physically there, you would be monitoring the machines and the procedures that goes along. And if something needed to happen, you would say to the tech, administer a half a milliliter of X, and then the technician would do that. So instead of you
Exactly.
physically being in the room, you're there virtually doing the exact same thing that you would be if you were sitting in the room.
Exactly. And consider that usually, in our everyday job, like if I was like on my physical job, like where for example, like Oklahoma State, or before when I was at Ohio State,
Yeah.
there is usually one anesthesiologist, and there is about 10 to 12 nurses, and we often have 10 to 15 cases asleep at the same time,
So you're
right? And so
bouncing
there's
from
one of
OR to OR. Like, how's this one doing? Okay, they're gonna get ready to
that
close up over here. We gotta start wrapping this up. So you aren't even in. So physically in person at Ohio State or Oklahoma State, when you're monitoring 10 cases at once or 5 cases at once, you're not physically in the room for all those. You're just bouncing in, monitoring them.
exactly. This is, you bounce by from OR to OR. You just look at the monitor, and it's like, okay, this is doing okay. This is doing okay. This needs help.
Yep.
And so then you go in, and you tell the nurse, or the technician, what to do. So this is exactly the same. It's in a smaller scale,
Sure.
but and it's virtual, right? So it's the exact same thing. It's just that, of course, it's over the phone, and that's what makes it much more affordable for these practices that are smaller,
Yeah.
and they obviously can't afford one of us full time.
To be sitting in there 24/7, 365, saying, or not 24/7, 365, but in like, just be in, be on staff, getting that salary, as you mentioned before, as a, board certified anesthesiologist, you're in such high demand, to say, hey, I need XYZ to be at your practice every day while you're doing procedures. So, you're very passionate about this. What from a animal perspective, and transitioning to this, what kind of is driving you to, you said there's expense, and And it's not all about money, but it's also the kind of the scary part of being an entrepreneur. Kind of what's driving you and your wife to say that we want to bring this to animal health across the country and potentially world.
Stay with us. We'll be right back.
This episode of the Veterinary Blueprint Podcast is sponsored by Butler Vet Insurance. Being an insurance agent at Butler Vet Insurance, I've seen firsthand the difficulties veterinarians face insuring their practices. But do you know that we wrote the book on veterinary insurance? It's called Protecting Your Veterinary Practice: Insider Insurance Secrets Every Veterinarian Must Know. It's not just a book, it's a comprehensive guide that speaks to the unique challenges and insurance solutions for the veterinary community. With over 20 years' experience from cyber liability to business auto and workers' compensation, our aim at Butler Vet Insurance is to reduce the stress of insurance for those dedicated to animal care. If you're a veterinary practice owner or manager and looking for some guidance on your insurance, follow our insurance blueprint. Discover the Butler Vet Insurance difference. And together, let's put the pieces of the puzzle together. Butler Vet Insurance, reducing the stress of insurance.
Well, you know, part of this was realizing that, I live 45 minutes to an hour away from where I actually flew from Oklahoma State.
Sure.
Okay. I don't really live in down where the university is. If something goes wrong with my dog, I need to take him around here.
Yeah.
And realizing that there is only 2 anesthesiologists in the whole state of Oklahoma, that's nuts. And nobody has access to one of us. We have 0 clinics actually in Oklahoma. We don't service anybody yet around here. And that to me made me realize even more. I was like, this is crazy. Like when I speak with my clients, like, Happy New York, in whole New York City, there is 3 anesthesiologists.
For all of New York City.
Yeah, in Long Island, there is 0.
Okay.
So like, this is like out of this world. Like, a lot of institutions out there, they hoard them, right? Like there is some places like UC Davis, for example, they have 12 anesthesiologists, and North Carolina State has 9, right? When the total pool is 200 or a little bit more, in some places have 10 or 5 or 6.
And 80% of them are in academia versus, they're writing protocols, but they're not in the trenches helping animal health on a day-to-day basis. With the veterinarian monitoring a case when it goes bad, they just can't call up the professor that you had 15 years ago at college and say, at veterinary school, and say, what should I do now? You're on your own in the OR trying to figure it out.
Yeah, it was the idea of like trying to expand care to as many pets as possible. We can cover way more pets by doing this. I mean, don't get me wrong, the people in academia are doing an amazing job.
Yeah.
Great, fantastic, but that covers the 1%, which is also the 1% that can afford this, right? Like they can afford, the $5, $6, $7, $10,000 bills that they will get in a referral place, versus like there's a bunch of pets that can't or pet owners that can't afford that, and that's why they go to their GPs. And we're not we're not trying to steal cases to anybody. Like these are pets that anyway they wouldn't go in a referral. They can't afford it, period. Like that's a bunch of cases that those places wouldn't see anyway.
Well, then you're making a financial decision based on animal health that you might not otherwise have to make if you can get affordable care at the highest level from your general practitioner. And then, back to the struggles that veterinarians are having just generally overall. You look at some of the market coming back down a little bit for some of them, down from the high COVID numbers. And the more that they can keep internally, if they can monitor potentially difficult case internally versus having to refer that out, they're keeping some of that. They're potentially be able to keep some of that revenue at their practice by offering, the service there versus referring it out.
Yeah, no, that's very true. There is a bunch of pets that, how many times I hear, this owner, it's really worried about anesthesia, or this pet, it's a little bit more complicated. It really needs to go somewhere with an anesthesiologist, but the owner doesn't have the money. And what ends up happening is they could do it at the vet, at the GP, but they can't afford the
Yeah.
referral, or the pet cannot afford to wait 6 months to get on a referral list, right? On a wait list. And what ends up happening is that the pet doesn't get care.
Yeah.
So who's losing here is the
The
animals, and
animal,
that's
yeah.
what made us
Well,
really
and
sad. And
the you know and the owners, right? Like the owners caring for their animal aren't able to make good decisions. I mean, my mom, like I mentioned about my mom, she I know how much she spent on that Gordon setter. She would have spent more than $200 on a consultation with an anesthesiologist before a call. She would have spent, four figures for sure, based on because she loved that dog, and so she knew that there were issues with anesthesia with her dog over time, and the more times they had to have procedures done and teeth cleanings and this other stuff, it just every time they went in, it got worse and worse. And so, I just know from my own personal experience through my mom and her Gordon setter Kenzie, she definitely would have made use of this service, and in fact was taking her dog to referral specialty center because she felt like she was able to get a higher level of care. So, well, in wrapping up, as we talk about this, what's one kind of tidbit you would give veterinarians who are thinking, how would this work for my practice, or how would I offer safer anesthesia or safer pet anesthesia at my practice, and integrate this in? What would that look like?
um, to get set up, it's super easy with us. You can just go on our website or our social media. You can look up Safe Pet Anesthesia on Facebook,
Yeah.
Threads, or Instagram, and we have all of our links there. It literally takes a 15 minutes conversation on Zoom. That's
So what you're saying is, and I'm a big again, a big sales guy. The number one rule in sales is make it easy for people to give you the money. So if you're a veterinarian out there who wants to offer safe anesthesia at your practice, you can do it with Safe Pet Anesthesia. And I think your website's safepetanesthesia.com.
it is.
Yeah. So we'll have all that in the show notes. What's one tip or piece of advice you would have for a veterinarian out there who's looking to become an entrepreneur and start their own side hustle slash all my eggs are in this basket, I want this thing to really work, business owner?
Well, go for it. Just jump in it.
Yeah.
Do it. If you can spend hours and hours and hours thinking about it. You can spend hours going through endless pages on Reddit and trying to figure out how to make it work.
Yeah.
And but the best thing you can do is jump, do it. And I think you're never gonna be sure that it's gonna work, but if you never try, you'll never know.
Well, I think what you've got with Safe Pet Anesthesia is something that can work. It was very unique. I liked hearing your story when we were at VMX, and I'm glad that you were able to come on the podcast today and share a little bit of your story and how you're bringing Safe Pet Anesthesia to every veterinarian out there who has got an internet connection and wants to use your services.
Thank you so much, Bill. We really appreciate being here, and we're really honored to be on your podcast. So
Perfect.
thank you for having us.
Absolutely. Well, we hope to see you soon, and we'll have some information in the show notes, but safepetanesthesia.com, Dr. Gianluca Bini. I got your name
Yeah.
wrong, but I'll get this. He's a board certified anesthesiologist at Oklahoma State University as assistant professor, entrepreneur, and founder of Safe Pet Anesthesia. Thanks for joining us today on the podcast. And as always, to all of our guests and listeners out there, make sure to like, share, and comment on the podcast. It will help with the algorithm on the back end. And we look forward to seeing you all soon.
Thank you, everybody.